Hey, how you doing, Larry? This is Kendrick. I'm calling you in regard of the Ohio living law. Just trying to make sure I have myself some type of case where I put money
Well, good afternoon, everybody. Good afternoon, and thank you for joining us. Thank you for joining the American Heart Association and American Stroke Association for today's virtual community conversation. I'm Valerie Hillo-Gates, and I'm your Executive Director for the Greater Cleveland Division. We are looking forward to spending an hour together this afternoon where we will discuss the warning signs and the risk factors for stroke and how you can act fast, that's F.A.S.T, to call 911 at the first sign of a stroke. May is American Stroke Month, and it is also Mental Health Awareness Month. And so today we will be exploring the connection between stroke and depression. As hospitals and health professionals and healthcare systems, governments and leaders work together to reduce the community spread of COVID-19 in the U.S. and protect the most vulnerable individuals in our communities, the American Heart and Stroke Association offers further tips for heart attack and stroke survivors regarding secondary prevention. Reducing risk of another event and staying as healthy as possible is more important now than ever. Stroke survivors and people with heart disease may face increased risks for complications if they get COVID-19. Recently, we launched a national campaign called One is Enough. This campaign urges individuals to take immediate steps to prevent having another stroke or heart attack. After a heart attack or stroke, sadly, as many as 1 in 4 survivors will have another one. Lifestyle changes and working closely with your doctors to manage your health can help minimize the risk of a repeat event. People with all ages, with or without underlying conditions, should do all that they can to stay healthy during this time especially. And that includes washing our hands frequently, maintaining social distance, staying home when possible, getting adequate physical activity, and eating healthfully. People with existing conditions like high blood pressure, diabetes, and heart failure must take active steps to manage their conditions with the help of their doctors. Again, thank you for joining us, and at this time, it's my pleasure to introduce Larry Bach, a stroke survivor who is going to share his personal story with each of us today. Larry?
Good afternoon. Am I on? I don't see myself. Anyway, so I am a practicing attorney in Akron, Ohio. I've been practicing law for 36 years in the same place. On April 9th, I woke up in the morning and found that my right leg was simply not working right. It felt like it was, if someone were to have seen me walking at the time, you would have suspected I was drunk. I simply couldn't control it the way I normally could. And unfortunately, I knew right away what it was, because this is probably the 3rd time it's happened to me. I have finally taken my doctor's instructions seriously, and since April 9th, I've lost 12 pounds. I've exercised on a daily basis. My blood sugar readings are within the norms, and my blood pressure is in normal to lightly elevated range through that time. So, I can't say that it was easy to do, but with some diligence, it can be done. It can be managed. A little bit more about me. I have all the warning signs necessary. I simply chose to ignore them. I suffer from chronic depression, type 2 diabetes since I turned 60, and also high blood pressure. I have a job that day to day has a fair amount of stress with it. And the best way for me to deal with all these medical issues is regular exercise, 30 to 45 minutes a day, and really almost every day a week. I don't know what else to add at this point.
That's great. No, thank you, Larry. Thank you so much for sharing. And I think you really included some important reminders and things for everybody to think about. So again, we really appreciate you sharing, and look forward to having you participate in the Q&A in a little bit. So now I would like to introduce Dr. Hussain of Cleveland Clinic's Neurological Institute, who's going to talk a little bit more with us around F.A.S.T, how to spot a stroke fast, and also the importance of really calling 911 or seeking medical care if needed, especially amidst this time during the COVID-19 pandemic. So thank you, Doctor, and I'll turn it over to you.
Thank you, Valerie, and thank you to the American Stroke Association for this opportunity to speak to everybody a little bit about stroke, especially in Stroke Awareness Month. We can go to the next slide. So it's really important, a little bit underappreciated overall. Many people don't recognize that stroke actually is one of the leading causes of death. It's the 5th leading cause of death in the United States. And perhaps more importantly, it's actually the leading cause of medical disability, with about 800,000 Americans suffering a new or recurrent stroke. That means that for every 40 seconds, there's someone in the United States that actually does have a stroke. But the good news is that 80% of these strokes are actually preventable, and we'll go through that in a bit of detail later on here. Next slide. We also know that there are certain populations that are at higher risk. African Americans are in the United States are at a greater risk of having stroke than any other race, with very high risks of risk factors like obesity and diabetes. Also the Hispanic and Latino communities, also having high rates of high blood pressure and diabetes. And also we're seeing increasing numbers amongst American Indians and Alaskan Natives. So really many other populations have a particular high risk. But again, fortunately, if we start to identify this and work on these risk factors, we can definitely prevent strokes from occurring. Next slide. So what we'd like to quickly go through with you folks today is to talk a little bit about the steps in how we can reduce risk of stroke, making sure we go through how to actually recognize a stroke and get into the hospital right away, and that importance of calling 911. Next slide. So first of all, let's talk a little bit about what a stroke actually is. A stroke is a sudden change in brain function related to a problem with the brain blood vessels. There are two main types of stroke. One is called an ischemic stroke. This is where a blood vessel gets blocked off. And we all know that the brain is one of the most sensitive organs to lack of blood flow. Unfortunately, when a blood vessel gets blocked off, that brain that's downstream can take damage and get injured. Next slide. Now, the other type of stroke is something called a hemorrhagic stroke. This is a situation where a blood vessel would burst. It could be an aneurysm or it could be another blood vessel that can leak or break. And that can then cause bleeding around the brain, which, although not as common as the other type of stroke, it is can be a very severe stroke and can be very devastating. The other term that I wanted to make sure we covered was that of transient ischemic attack, or something called TIA. Another commonly known term is mini strokes. This is a situation where the symptoms were temporary but go away, and that's usually related to there was a blocked blood vessel, but fortunately it opened back up. It's a very important condition to recognize, though, because this is a major warning. It can potentially be a warning sign that a bigger stroke is about to happen, and that's why it's really crucial. If you have any kind of stroke symptoms, it's important to call 911, get yourself to medical attention right away. Next slide. As mentioned, again, it's really important to recognize also, we used to think that stroke was just something that happened, there wasn't much you could do about it, but we know now that stroke is very much a preventable condition. About 4 out of 5 strokes can actually be prevented, and we'll go through that in a little more detail here. Next slide. Now, of course, there are some things that we are a little bit beyond our control. The #1 risk for stroke overall is actually age, which unfortunately we don't have the cure for yet, but hopefully one day we'll find it. We also know that there are other risks, things like women, for example, having more strokes than men. Strokes can sometimes run in families. Those having a prior history of stroke or heart attack are also at increased risk in the future. And as we mentioned, race is a very important factor as well. African Americans, Asians, those of Latino or Hispanic descent all have much higher risks of both having strokes and can have more severe strokes as well. And so important to recognize this. There's also other conditions that can potentially be present in an individual, things like fibromuscular dysplasia and other conditions. So really important that when strokes happen, we work on trying to identify these risks as much as possible and tailor treatments towards those specific conditions. Next slide. Again, it's also really important to remember we have a lot of ways to prevent strokes from happening. And so to start off with, we'll talk about this Life Simple 7. And what you'll notice as I go through this here is that there's a lot of these factors that are actually just lifestyle, very, very important lifestyle measures that one can take to prevent both heart attack and stroke. Number one, make sure we're very, very active. Get active. Try to get at least 150 minutes of moderate activity or 75 minutes of vigorous activities. Really spread that out throughout the week, and that'll do a lot to keep those blood vessels nice and healthy. Diet, we can't underemphasize the how important a role diet can play in things. Eating a good, well-balanced diet, making sure you're limiting the amount of saturated fats and trans fats, sodium levels if you have high blood pressure, red meats, and artificially sweetened beverages. Diet can play a very, very significant role in promoting these risk factors, and therefore by eating a good, healthy diet, you can really stave off a lot of these risk factors that can lead to problems. Number three, losing weight. Even losing a small amount of weight, even something as 5 pounds, can really, really dramatically change things like risk factors and keep those blood vessels nice and healthy. Next slide. If you smoke, very, very simple advice: don't smoke. There's just no other way to put it. There's no good reason to do it, and it really damages the body in so many different ways. And then we talk about the other classical risk factors, things like blood pressure, cholesterol, diabetes, making sure you're getting those things, keeping close contact with the medical professional, get those risk factors checked out. Of all the risk factors that we've talked about, the number one that contributes the most to stroke is high blood pressure. And so really, really important that everybody knows their blood pressure readings. And if you do have high blood pressure, make sure you speak with your physician and then work on getting that under good control. Next slide. So we'd like to spend a little time also talking about the stroke signs and symptoms. It's actually, unfortunately, only about 30% of Americans actually even know one symptom of a stroke, but fortunately we have this very nice acronym that was developed by the American Heart Association that really helps us to remember these symptoms. And so we'll go through it. The acronym is called FAST. So starting off with F, that stands for face. Is there droopiness on one side of the face or the other? A, standing for arm, is there weakness of the arm? You can ask someone to raise their arms up in front of them and see if one arm drifts. S, standing for speech. Does someone have difficulty speaking? Are they difficulty getting their words out, slurring their words, or they're having difficulty understanding? And then that T is in there as the, again, reminder about how important time is in this situation of stroke. Stroke is probably the most time-sensitive condition in all of medicine. We estimate that it's probably you lose about 2 million brain cells in a minute in a situation of an acute stroke. And so I think everybody would agree that we want to retain every brain cell that we can. So every second, every minute counts in this situation. T stands for time. Call 911 and get to medical attention right away. Next slide. So again, remember that FAST acronym: face, arm, speech, and time. Again, T standing there for time to call 911. Next slide. There are some other symptoms we usually like to talk about. You can say, sudden onset of numbness, confusion, vision problems, difficulty with balance, and especially in anybody who has a risk of aneurysms, brain aneurysms, if they break, they can sometimes cause a really severe, intense headache, worst headache of your life. Any symptoms like that, that's another reason, call 911 and get to medical attention right away. Next slide. And again, we can't underemphasize the importance of time here. We have very, very good treatments for stroke, but they are time dependent. The faster you can get to the hospital in that situation, the better your options are, as well as the better chance of you having a good outcome. Next slide. So, for today, if everybody who's on this call, and if you talk to your loved ones as well, or other friends and colleagues, make sure you know there are important to know hospital capabilities in your area. Know which places are the places you can go to get stroke care. Again, calling 911, the paramedics, the EMS professionals are very, very attuned with this and will get you to the right place. And also know those stroke warning signs and symptoms. Next slide. And again, really embracing those Life Simple 7, talking about those lifestyle measures: exercise, eating a good diet, not smoking, knowing your risk factors, especially blood pressure. And again, try to share this information with as many people as you can, because every person that knows this information, that's potentially another life that might be at risk, and potentially you could save a life by knowing this information. Next slide. I also want to just wrap up with just a couple of comments about, since we're in the midst of this COVID-19 crisis. There is some links with stroke that are emerging in this. It's still very early on, so we're still needing to have a lot of research and data on this, but it does appear that in areas where there's very, very high risks of high amounts of COVID infection, we are seeing increasing stroke rates. It can potentially be in younger patients and also may present with more severe strokes. So remember that stroke is not just a disease of older age. It can happen to anyone at any age. And so making sure everybody knows those stroke signs and symptoms is really, really important. Next slide. Interestingly, we've also noticed that though where COVID hasn't necessarily really exploded, and we've been able to control the cases in these areas with social distancing and other methods, there's actually been a decrease in stroke cases. And so people have speculated whether there could actually be less strokes occurring, but we've also seen people coming to the hospitals who've actually delayed coming to the hospital because they're afraid of coming to the hospital. They're afraid of getting the COVID infection, afraid that the hospital is overrun. It's really, really important, though, to recognize that both for heart attack and stroke, that these are emergency situations, and the hospitals have taken measures to prevent issues with COVID, keeping both patients and caregivers safe. The best and safest place to be in the situation of emergency like stroke or heart attack is to be in the hospital. So don't ever hesitate to call 911, even in the situation we're in now. Call 911, get into hospital right away. Again, I appreciate the time, and I'll hand it back to Valerie.
Great. Well, thank you so much for sharing that important information. I see we had a couple of questions starting to come into the chat box, so please feel free to continue typing your questions for Dr. Hussain into the chat box. And at this time, I will now introduce Dr. Matt Sacco, also of Cleveland Clinic, who's going to talk with us a little bit more about the mental health connection and specifically the post-stroke depression. Dr. Sacco?
Thank you, Valerie, and thank you for having me. We'll spend a little bit of time most focused on this post-stroke depression, although I acknowledge that anybody who is experiencing life after having a stroke is likely to experience other symptoms as well. So please don't think that depression is the only thing that we're going to be addressing and talking about as it relates to mental health. So next slide. So first and foremost, an important distinction to be made here is that not every single person who experiences a stroke is going to actually meet criteria for some sort of diagnosable depression. And in fact, it's very common that this difference between depression and what we refer to as adjustment disorder, it's important to understand that sometimes that there are what we might expect to be typical reactions to some significant life event. And losing somebody, having a severe medical crisis, there is a range that we would expect somebody to struggle with emotional well-being. However, if it starts to seep out and beyond what your provider would think might be typical based on what's going on, and it's under that 6-month time period, then we might look at that something being more of an adjustment disorder, which seems to be a little more transient and temporary, and will kind of resolve itself. That being said, it's certainly working with a professional is important there. The depressive symptoms and what we might consider more diagnostic depression typically is not event-centered, meaning there are usually a combination of other factors that include environmental factors, genetic factors, psychological factors. Sometimes folks have pre-existing depressive disorders or episodes. And then, of course, the last point on there is very common, this condition brought on by a medical crisis, meaning that there are direct physiological links to the changes that occur in the brain during a stroke, or there are other medical conditions as well that directly lead to the creation of a depressive episode or disorder that was not there prior, and there were no other kind of symptoms prior. And that's where the post-stroke depression seems to fit most clearly. And that's why it's often very common when you talk about having damage to the brain. So next slide. And so we kind of get into this idea of, well, what do you do when you're experiencing symptoms of depression after you've had a stroke? And some of these loop back very nicely to some of the points that Dr. Hussain had made. But first and foremost, and as a mental health professional, this idea of taking care of yourself encompasses a lot of different topics, including things like, you know, making some of those lifestyle changes that are going to reduce your risks. You know, being, you know, having the supports of family and friends, focusing on things that you actually have the ability to control, whether it's a lifestyle factor, whether it's, you know, who you're around, things like that. Oftentimes slowing down, taking breaks, things that people who experience stroke, who are living their lives and all of a sudden have this very acute emergency that pulls them from their normal functioning, they're not accustomed to taking breaks. They're accustomed to going full speed ahead. And sometimes that's really difficult, because oftentimes it can be very difficult for the person who has experienced a stroke to actually notice the differences and the changes that others can see. So folks may think that they're plowing through just fine, and in reality, there are a lot of challenges that they're not picking up on. So taking breaks, acknowledging the loss, and this idea of staying active and social, with the caveat here, this as it relates to the COVID crisis, it's more difficult. It's more difficult to meet these social needs and get the benefit out of these social connections that many folks would get otherwise. So keeping that in mind, you know, being as social as possible is important. Next slide. So these are a list of, and I'm not going to read them all, but common signs of depression. And typically, you could read any one of those bullets and maybe acknowledge having that experience from time to time yourself. And it's not necessarily because you check that one box that you have some sort of diagnosable depression. The more symptoms that you experience and the longer period of time that they go on is important. But most importantly, does the accumulation of these symptoms lead to an interruption or a dysfunction in daily living? So if it's not necessarily something that is bothering a person or slowing them down, or their loved ones acknowledge that it's not that big of a deal, it may not be some depressive episode that you need to worry about. That being said, the more these things can pile up, and of course, things like decreased energy, fatigue, those can be absolute physiological consequences of having a stroke in and of themselves. So it's very easy to see how the physiological reaction to depression can mirror and mimic very much what a person may experience from having a stroke itself. Next slide. And so it leads kind of to this idea, well, what do you do? How do you treat it? The good news is that these things are common, and that medical teams have a lot of experience and practice identifying and treating this stuff. And I think one of the more important things to notice on the front end, and to kind of parse out here, is that there are medical and medicine approaches to treating depression, and there are non-medication or behavioral approaches. And I split this way because oftentimes it can be really common for folks to mix up the difference between psychiatry and psychology and therapy. So anytime you're talking about medications, these are all types of medications or categories of medications that are used to treat depression. And in fact, the same medications often that we treat just generally diagnosable major depression without stroke are the same ones that we would use or see being used in folks who've experienced a stroke. But the neurology team and the psychiatrists are those that are responsible for prescribing medications. That could also be a primary care provider. But tricyclics, most commonly we'll see here folks who are familiar with the term SSRI, which is the selective serotonin reuptake inhibitor, and then SSNRIs and psychostimulants, things like Adderall, things like that, that are often used for fatigue and things like that. Where my role kind of falls in this is as a psychologist, is working with folks in individual counseling or therapy, and it could be psychologists, social workers, counselors. There are lots of really good folks out there that are really good at helping folks deal with medical crisis. And that's something that can really be an additive to your stroke, post-stroke treatment, is to get some help and some support from those individuals. And there are a variety of ways that folks kind of practice. So it's just important to note that those differences as they're laid out there. Next slide. All right. So I think that one of the things that is, to wrap up my piece here, that is probably really, really important for folks to understand, is that getting the input, if possible, of those that are around you or the person who's had a stroke, they can help provide a measuring stick for kind of understanding some of those differences that have occurred since the stroke. When someone has experienced depressive symptoms that weren't there before, that's important. We also often see folks who have struggled with a variety of mental health conditions that seemingly, basically all a stroke may be doing is throwing gasoline on a fire that was already burning. So having that information is really helpful, and working hand in hand with your providers to get some answers and get some help goes a long way, because treating depression, treating anxiety, treating these conditions actually leads to measurable improvements in recovery, and it can make rehabilitation a lot easier. And just kind of taking control of what's yours to control and managing these things is absolutely that. So with that, I will turn it back over to Valerie. Thank you.
Great. Thank you so much, Matt. And thanks for sharing all those important things for us to be looking out for. So I think we're going to be moving into our Q&A session. So I'd like to introduce the Community Impact Director for the American Heart Association, Lisa Wheeler-Cooper. Lisa will be guiding us through our Q&A. And again, feel free to use the chat box to submit questions that we can address.
Thank you so much, Valerie, and thank you to our speakers for sharing their expertise. And we do want to remind folks to enter your questions into the chat box, and we will try to answer as many questions as possible. And we already have a few that have come through the chat box. So I will start with those questions. So Dr. Hussein, there's a question in the chat box from Trisha Winchester. And Trisha wants to know, do blood vessels in the brain develop plaque like blood vessels elsewhere in the body?
Yeah, it's a very good question. So blood vessels in the brain certainly can develop plaques or blockages similar to other parts. We actually see this more commonly in Asian populations as well as African Americans, as compared to other populations that get more blockage in the neck blood vessels. Stroke also, though, is a mixed bag. So many of the blockages that are up in the brain are actually clots that come from elsewhere in the body, like from the heart. But yes, you can develop plaque in those blood vessels.
Thank you so much. And then there's another question that I'll toss to you, Dr. Hussein. What are the symptoms of a mini stroke, and will they even be noticed by individuals or family members?
Yeah, it's a good question. Now, again, for the mini stroke, these are the exact same symptoms as you'd experience with a full stroke. So again, remembering that acronym of FAST: face droopiness, arm or leg weakness, or speaking difficulties. They are all the exact same symptoms. The difference is that these symptoms go away, usually within 1 hour, and the person will feel like they've come back to normal. If they persist, then if they don't go away, that's where we call it a full-blown stroke. But again, to remind everybody that even if the symptoms go away, if they're there just for a short period of time, only last 5-10 minutes, there still can be a very, very serious warning sign. You want to get that checked out right away.
Thank you so much. And this is a perfect to Larry. So Larry, you experienced a TIA. So prior to your TIA, were you aware of the stroke warning signs and risk factors?
Yeah, I absolutely was, but in all honesty, I ignored them. In 2012, my father passed away in November, early December 2012. I was coincidentally visiting a doctor client of mine at his office, and as I left the office, I felt some numbness in my right leg. Not as pronounced as it is or was in April this year. I spent the night in the stroke ward in Akron City Hospital, and I really never got a diagnosis that it was a stroke or a TIA. My primary care physicians thought that I had an ocular migraine and explained what that was, and I recognized the kind of the spottiness at your eyes, and so okay. Then fast forward to 2015, and I'm sitting in my office, and I had a hard time with my right hand. My fine motor skills simply weren't there. So that prompted me to talk to, again, my primary care physician, and he said, no, I don't think this is an ocular migraine this time, and sent me to a couple neurologists, both at the Cleveland Clinic, and they were absolutely wonderful. But the initial diagnosis was more that it was possibly MS. And again, so because both of these episodes were very short term, I mean, less than 24 hours, I didn't take it all that seriously. This time I've taken it seriously. It was much more severe than either of the two earlier episodes. And, I'm kind of thankful that this is all it was. They don't have any facial paralysis or any really loss of activity of any of my limbs. My tennis game isn't quite what it was, but I kind of stunk at it anyways before that. But so yeah, I did have the warning signs. I simply chose to ignore them.
And so knowing what you know today about stroke, what would you do different? What would you have done differently?
Well, here, I've been able, and since April 9th, when I checked in the hospital on April 9th, I weighed 186. Now that was down from the 190. So I thought that I was making progress, but I was just fooling myself. So in that time, I've dropped, but this morning is at 174. So I think that's a pretty good drop in a short amount of time. And it really wasn't that difficult to do. Watch what you eat. Most restaurant, of course, we haven't really been going out to restaurants at all, but you get a serving in a restaurant, that's enough for 2 or 3 people. And, I've kind of embraced the idea of pasta. If you're gonna have any pasta, less than the size of a hockey puck, and really, I kind of tend to avoid it altogether. And then incorporating exercise into a daily regimen. Then the other thing that I've done, and I think we can hold this up, I keep each morning and a couple times a day, I monitor my blood sugar and I monitor my blood pressure. And then, I don't know if you can see this, I just prepare a table, and as on a daily basis, I submit, I put in my table what my weight was, my blood pressure readings, and my blood sugar readings. So that has helped me be really focused on those readings, and I think it's helped me. I mean, I can kind of traffic graphically that they're making improvements.
Thank you so much for sharing. And so I will go to Dr. Sacco next. So Latoya Trice has entered the chat box, and she says, Dr. Sacco, someone I knew had a stroke, and it seems like his personality changed. he became a little bit annoyed and angry with people he cared about. How can I let him know that there is help without him feeling upset? I don't think that he knew he had post-stroke depression.
Yeah, thank you. That's a really good question and really common experience for many folks who loved ones of a person who's had a stroke. So there are some, first of all, the kind of the irritability and the anger in our kind of culture and our society. Those are actually probably the most common symptoms of depression that men will actually cop to. So a little bit of irritability, shorter fuse, things like that. So it's important that to identify, those kind of symptoms of depression from a true personality change. And usually that is just something that goes on over time, because depending on, and Dr. Hussain could certainly speak more to this, depending on where a stroke occurs, absolutely someone could have a complete personality change. And that would be a little bit of a different approach to treatment than somebody who is having post-stroke depression. Now, in terms of being able to provide information without maybe offending someone or causing them to be irritable, I think the easiest and shortest answer to do that, as I'm sitting here right now, would be to kind of point them in the direction of even this program right here, and to just kind of expose someone kind of secondhand to some information that they can kind of take in. And you do have to ask yourself, kind of, is the risk reward of putting that information in front of someone, is the risk of them being irritable and angry or frustrated at you worth having that information, knowing that they have that information? I wish there were a real clear, textbook answer for that, but everybody's different, and finding someone that they see as supportive, and that being the avenue to maybe reach them. But that's kind of the best that I can answer in that one. So.
Thank you so much. And I will go back to Dr. Hussain. So Dr. Hussain, we talked about how the African American and Latinx communities are at greater risk for dying from stroke and having a stroke. And so I know that the Cleveland Clinic has the Minority Stroke Center, and you work closely with Dr. Lynch on that effort. Can you talk a little bit about what you're doing specifically through the Minority Stroke Center at Cleveland Clinic to address the disparity among minority communities?
Yeah, it's a really important area that I think is probably, we should have been paying attention to this quite a while ago. As mentioned, we know these African Americans, Hispanic communities, Latino communities, as well as Asian communities, all have increased risk of stroke compared to the general population. So it was important for us also to be able to recognize that there is this disparity, and then trying to sort out how best to get information to these folks, how we can tailor treatment specifically, taking those factors into consideration, as well as using those folks as who are willing to be a part of it, to be able to go back to their communities to help educate other people around about these stroke signs and symptoms, so we can prevent strokes from happening even down the line in the future. So I think Dr. Lynch, under the direction of Dr. Maudlin, has done a fantastic job with this. This clinic was launched probably about a year ago, and we're really seeing a lot of very nice patients getting into the program, being able to identify their specific risk factors, being able to connect with them in a way that's meaningful, that can really provoke lasting change. And then now working with those same patients to go back to their communities, go back to their churches, other community centers, so that they can educate their family, friends, other people in their communities, so we can really make sure that everybody understands these stroke signs and symptoms, how to really benefit a healthy lifestyle. And I think along with that, there's going to be a lot of research and other things that are necessary, which we're really starting to get off the ground now, to really help understand, how we can treat these communities better.
Thank you so much. And I have another question for you, Dr. Hussain, that's come through the chat box. So Andrea is asking, can a person get a stroke while sleeping, and do they stop breathing?
Yeah, it is possible for a stroke to start when someone's asleep. Typically, we think that this actually happens very close to the time they wake up in the morning. And so this has allowed a whole branch of research now to try to understand if there are treatments similar treatments we can offer to people who are awake or with somebody when their strokes happen. So it's really expanding treatment options. So that is possible. Now, in terms of losing ability to breathe, that's actually, there are certain types of strokes that can do that, but they're pretty rare overall. So it's a little unusual to see a person just to stop breathing as a result of a stroke.
Okay, thank you so much. So I have a question for Dr. Sacco. So we've talked about the connection between depression and stroke. Can you talk about why mental health and well-being is so important for those recovering from various cardiovascular diseases and other chronic illnesses? Why is mental health and well-being so important to one's recovery?
Sure. Yeah, there's actually a really powerful line of research looking at the role of stress hormones and stress on our body's physiological ability to recover. So it certainly directly affects our ability to, and how quickly we may recover and heal from some sort of an injury like a stroke. I think that piece of it, when we start talking about the physiological consequences, it's a little bit harder to kind of maybe measure. What I would say is probably more common is being able to manage depression or anxiety or something like that actually directly relates to a person's ability and willingness to get connected and stay connected with their either treatment team, their rehab team, the folks that are necessary to kind of improve their recovery. Oftentimes, for example, folks who do struggle with some sort of post-stroke depression, they kind of get into this cycle of not feeling like it. Not feeling like getting out of bed, not feeling like going to those appointments. And unfortunately, like is the case with depression across the board, if folks wait till they feel like it before they go ahead and take that step to go to their doctor, go to their appointment, they're not going to get there first. The feeling like it actually comes after they kind of put these things together. So being able to get adequate and appropriate treatment to help through some of those times can keep people connected and attending their appointments, getting to their physical therapy, getting to their speech rehab, whatever it might be. This absolutely untreated mental health conditions absolutely are like concrete barriers to direct improvement and functioning in some of these areas. So that's a real everyday example as to why it's so important to manage these things.
Thank you so much. Dr. Hussein, it's back to you. So Tricia has indicated in the chat box that LPA excess can contribute to the increased risk for stroke and is considered a hidden risk factor because it's not seen by a lipid panel. Do you think more individuals should be screened for this risk factor?
Tricia is very sharp and asking really great questions today. This is really fantastic. So, lipoprotein A elevation, you're correct, it can be a risk factor for stroke and isn't tested on traditional cholesterol panels, so it'd be a special test. The lipoprotein can do two things. It can both increase or accelerate cholesterol buildup in blood vessels, as well as it causes the blood to be a little more prone to clotting. So it is an important risk factor to identify, especially we look for it in younger patients. And typically it'll run in families. So if we hear a history of a person who's had other family members who've had either heart attack or stroke at a young age, under the age of 60, that really puts up our antennas on that and then would be running that test in those individuals. That being said, in terms of lipoprotein A elevation, it's not something necessarily specifically that there's a specific treatment for. It comes back to largely the same things about eating a good diet, exercising, making sure that we're controlling other risk factors like blood pressure, making sure a person's on a cholesterol lowering medication, make sure we're doing a really good job with that. There is new areas of research though going on with lipoprotein A, and so there's some really interesting new genetic what they call RNA treatments and medications that can target the genetics of this, which will be very interesting to see what happens with that in the next 5 years.
Thank you so much. And Dr. Hussein, I'm going to stick with you just a little while longer. So we have Jacqueline who is asking if you can touch on racing of the heart and if this can lead to a stroke.
Yeah, racing of the heart or palpitations can be linked with underlying condition called atrial fibrillation, where there's an abnormal heart rhythm where the top chamber of the heart, called the atrium, really just, instead of pumping fully, will stand and quiver. There also probably are changes in the wall of that part of the heart that can cause it to be more prone to clotting. Sometimes people will feel those palpitations. It also can be silent, and is one of those conditions that we see the older someone is, the more likely they are to have it. It is an important, if you do feel like you have heart palpitations, really consulting with your physician. Usually what they'll do is an EKG or even put you on a heart monitor for a period of time to look for that. And it is something we also look for if someone has had a stroke. One of the very, very important conditions we look for as a potential culprit or cause for the stroke, so we can make sure we get people on the right treatment, which in this case is stronger blood thinners.
Thank you so much. And we have so much activity in the chat box. So thank you for submitting your question. So Dr. Sacco, I have a question for you. So Francis Mills would like to know, how long does post-stroke depression last? And are patients with long-term personality change referred for mental health evaluation?
Okay, yeah, a couple of really good questions. So, you know, the answer to kind of how long post-stroke depression can last, it's really variable. It really depends on the person. Usually, what we're seeing in folks is it often kind of comes in waves, where they may go through periods of time where they experience more significant symptoms of depression, and then it may seem to kind of remit a little bit. And depending on, you know, other factors, other things going on in their lives, you know, people will kind of rebound for a while, and they may experience waves of it again. It's not necessarily something where we necessarily see somebody who becomes depressed, this low-level depression, and it's just permanent. Like other types of depression, it is intermittent, often and variable, but it can go on indefinitely. You know, and that's why treatment is so important, because with treatment, the symptoms can remit quite a bit, and people can learn some skills and things that will help prevent some of those waves from coming on, being able to detect them when they are coming on, finding out things that they can take control of and do to lessen the severity of it. So the treatment piece is key. In terms of the referring for a mental health evaluation for personality change, you know, I know this is kind of a really, really, really generic answer, but I would say you don't even need to have a personality change to have somebody referred to a mental health evaluation, because anytime someone has experienced something as significant as a stroke, it changes things. And even if for a period of time, just for, you know, for some support, some answers, just some contact, I would say anybody who's had such a life-changing event could benefit from having sitting down with a mental health professional to talk about the impact that it's had on their lives. I wouldn't necessarily even wait for any other kind of symptoms to arise, because it is in and of itself a drastic change in life.
Thank you so much. And Dr. Hussein, I have a question for you. So Alex Kuhn is asking, what are the different types of treatments for stroke? Do all hospitals do it? And how does EMS know which hospitals provide which care?
It's yeah, great. The really important question. To talk about the different treatments, a very common treatment, if someone is able to get to the hospital within 4.5 hours of their stroke starting, is a clot buster medicine you can give through the intravenous called TPA. Basically, the idea is you give it through the intravenous, it travels to where the clot is and dissolves up the clot. Very, very effective treatment, and it can be offered within 4.5 hours of symptom onset. And that really can be given in the majority of emergency rooms, particularly places that we consider either acute stroke ready hospitals or primary stroke centers. Definitely offer that level of capability, and there's different certifications that are out there for that. The other major treatment we have for stroke is something called thrombectomy, or it's where we take small catheters through the blood vessels to where the clot is located and use devices to remove the clot out of the artery. This is meant for what we call ELVO type stroke or emergent large vessel occlusion. This is where a larger blood clot gets blocked off a pretty major branch of the brain. You can imagine if there's a large clot there, we still can potentially give TPA if they're early enough on, but when it's such a big clot, it's a little bit hard for our medicine to dissolve that up. So usually we need a device to remove that out of the blood vessel. This requires a little bit more specialized center though, either what we call thrombectomy capable centers, which we have, 4 here in the Cleveland, Northeast Ohio, and Akron, Hillcrest, and Fairview Hospital, as well as what we call comprehensive stroke centers, which are the Cleveland Clinic main campus, UH main campus, as well as Metro Hospital's main campus. And so those are the more severe strokes. And EMS, we're working very closely with our EMS colleagues to really identify. In the past, we've largely focused just with EMS identifying is it a stroke or not a stroke and getting to the closest hospital. We now know that with these severe strokes, the ones that are the big blood vessels that are blocked off, and needing to get them to those, the thrombectomy, the centers that can do that thrombectomy procedure, getting the patient to the right place the first time, it's important to really identify not only is there a stroke or not, but what the severity of that stroke is. Our EMS colleagues, have tools now at their disposal to be able to help them to identify that, and that may then mean that they drive a little bit past the first hospital to get to one of those centers that can do that thrombectomy procedure.
Thank you so much. And I have one final question before we get into our closing remarks. So, Dr. Sacco, we have a question about mental health and specifically depression. Does regular exercise help treat depression? And if so, how much?
Absolutely it does. I think we like to stick to that same kind of standard that was mentioned earlier today. Sometimes just the 20 to 30 minutes of cardio is helpful. Some studies actually have shown that as little as, and just for the depressive piece, as little as 10 minutes of light walking on a treadmill led to improvements in movement. So the answer is yes. I mean, I tell people all the time, if you've ever had that moment where you tell yourself you're going to get up and go for a walk today, and then you say, no, I'm not going to do it. No, yes, I'm not. You get out on that walk, and just after a few minutes, you may say to yourself, well, I don't feel awesome, but I'm really glad that I did this. I'm glad that I got out. That's absolutely an example of how just doing something like exercise can change the chemistry in your brain and actually lead you to start feeling a little bit better. And linking these days upon days upon days of doing this absolutely has been shown to help with depression, as well as just about any other mental and physical concern that someone might have. But absolutely, yes, it does.
Thank you so much. So we've covered a lot of important information today, and I would like to give our speakers an opportunity to provide any final thoughts with the audience. So in closing, Dr. Hussein, what would you like to leave our audience with today? What do you want them to take away from today's conversation?
Again, thanks for having me. Again, we really like to emphasize to people to understand that stroke is a major problem, but there's a lot we can do to prevent strokes from happening. Really embracing those lifestyle measures that we've talked about, the Life Simple 7, eating a good diet, getting that regular exercise, controlling your risk factors, so important. And then, of course, FAST. Remember the FAST acronym: face, arm, speech, time to call 911. We can do that if we spread that knowledge out amongst as many people as we can. Be a much safer situation for stroke. Hopefully preventing strokes is happening in the first place, and unfortunately if someone has a stroke, they'll get to medical attention and have a much better chance of getting better from it.
Larry, from a patient perspective, what do you want everyone to know today as they walk away from our conversation?
Yes, well, thank you again for letting me share my story. If you have any of these symptoms that I've relayed, take them seriously. It's nothing to fool around. And I had two warning signs, and I'm sorry they did it. The other thing I want to add is, if you're having an incident, despite the presence of COVID, go to the emergency rooms. Don't about it. I did, very happy that I did. I felt entirely safe, both at the regional Akron General Bath Facility and also at Akron General Hospital.
Thank you so much. Dr. Sacco, what are your parting words?
You know, the one thing I would say is don't hesitate to ask for help. You don't need to have a specialist who works in a stroke center like I do. There are very, very, very good providers in the community that are absolutely equipped to help folks deal with the adjustment and the crisis that follows having something like a stroke. You know, reach out to your neurology team, reach out to your primary care provider, ask them for recommendations. Because even if you find out that it's just a few sessions, I think that you'll find that it goes a long way. And as we work in this country to, you know, destigmatize mental health across the board, kind of tying mental health and our physical medical well-being together like this, it is one step in that process. So please don't hesitate to ask for a recommendation or for help, because it will absolutely make a difference, and people will improve their functioning.
Thank you so much to all of our speakers. And before I pass it to Valerie for closing comments, I just wanted to share, I heard some folks asking about resources for family members. The American Heart Association has a lot of online resources that are not only for stroke survivors, but they're also for caregivers. These include information sheets. We also have videos that highlight exercises for stroke survivors after to help them recover. And we have a warm line where you can call and get support and resources. And we also have an online stroke support network. So all of these resources will be shared with everyone in a follow-up email after today's call. So thank you so much for joining. And now I will pass it to Valerie for closing remarks.
Thank you, Lisa. And again, I thank each of you for taking some time out of your afternoon to join us for this community conversation. As you heard from our speakers, stroke is a medical emergency, and the sooner you act, the better your chances for recovery. As one action step from today's program, I would like to ask each of you, if you have not yet, to join our You're the Cure network. It's the American Heart Association's online advocacy program. This way, you can be among the first to know when major policy initiatives pass or when your help is needed to advocate for an issue. You visit yourthecure.org to learn more. Again, that's your, Y-O-U-R-E, thecure.org, O-R-G, to learn more. It's very simple to sign up, and it's very simple to use. We encourage you to take action and share with others what you've learned today about the stroke warning signs, and never hesitating in seeking medical attention or calling 911 when needed. So thank you for your time today. We're going to close out the show with a short video. So thank you, take care, and be well.